So I've found in the physical therapy world that if you haven't had training experience, that coaching movement becomes difficult. The thing is, we're movement experts and we need to truly be able to guide our patients through movement to get them out of pain. And the one exercise that we all strive to really perform and coach well is the deadlift. The thing is, the deadlift is a very technical movement. So you really need to think about the biomechanics of your patient, their pain, their patterns, their posture, all these things that go into appropriately prescribing the deadlift. So in today's video, I want to go over 4 tips that you can use to maximize your deadlift coaching so that you can get your patient or client moving pain-free. Tip number 1, don't squat the deadlift. The squat and the deadlift are 2 totally different exercises. They are like apples to oranges. They're non-comparable. And with that non-comparison comes 2 totally different trajectories. The squat should be very vertical or elevator-like. The deadlift should be very horizontal and escalator-like. When someone squats the deadlift, they start moving through 2 motions instead of the desired one. Biomechanically, what's happening is that the patient is now moving through hip flexion, knee flexion, and then knee extension and hip extension. When in reality, they should be going through one motion, which is hip flexion into hip extension. When they follow this trajectory and this movement pattern, they are moving in the horizontal direction, not the vertical direction. And when they do this, they maintain the proper muscle activation. The hips remain the primary mover instead of going through the knees, which usually tends to kick on the low back. So if your patient is complaining of low back pain during their deadlift, check to see if they're moving through 2 motions, and if they are, they need to really be educated that it should be 1 motion, and you could do that by raising the floor, educating them on form, or changing the exercise as a whole. Tip number 2, don't pull the deadlift. Contrary to what you may believe, I actually want you to start to push instead of pull. Now, I know that may sound counterintuitive, but the goal and the idea here is that you are putting force into the ground instead of pulling and decreasing the amount of force away from the ground. So you can get your patient or client to understand this by telling them to imagine that the floor is a leg press. As they go throughout their deadlift, they are going to start to push into the ground and start to press and develop force and push the floor away from them instead of pulling the weight up. What you'll find is that when your patient or client does this, they're going to be a lot more forceful with their deadlift. Also, they're going to start to really recruit the hips and keep the movement out of their low back. Tip number 3, you're not required to perform a traditional deadlift. So if you're working with powerlifters or someone that is required to perform a very specific deadlift for their sport, then you can disregard this. However, a lot of our patients and clients will benefit from learning how to go through the movement and recruiting the appropriate muscles. So it's not required that they have to go in a barbell conventional deadlift. The other reason why we don't need to perform a traditional deadlift is because a lot of our biomechanics of our patients and clients just simply won't allow it. So if the biomechanics and their patterns don't allow it, and their overall goal isn't to perform this in a sport, then why do you feel held down or bound down to performing a barbell traditional deadlift? Instead, you can use a trap bar, a kettlebell, hinge, in any other motion or pattern to still recruit the muscles that the traditional deadlift will do. The nice thing about this is that you can modify it to your patient's needs. So if they need to raise the floor because they're trying to squat the deadlift, you can do so. If they need to really focus on hinging back because their biomechanics don't let them, then you can use a kettlebell and really get them to reach back and let them learn how to appropriately pick things up. Ultimately, what is going to dictate why you would choose that traditional barbell deadlift versus another variation is the patient or client's goal. Tip number 4, don't lift your head up. Now, I know that might be hard for some of you because you've been really taught and seen this over the years of training people to really keep that head up and keep that chest up. The thing about this is that it really just drives extension through the wrong places. When we start to go into that head up, chest up cue, we develop an extension-based pattern. Yes, we do want extension to get out of that deadlift, hip, flex position. However, we need to get the extension in the correct places. The hip should be the primary extender, not the cervical, thoracic and lumbar spine. Instead of cueing head up, chest up, tell your patient or client to keep their chin down as if they're holding a tennis ball and they don't want that tennis ball to fall. And as they go through that, you'll be able to see a much better neutral neck, and you will start to see that they drive and put more of the emphasis into the hips instead of other places, i.e. lumbar spine, in that extension-based moment. So I hope you found that video valuable. If you want to take this video a little bit deeper into a level that will raise your coaching standards and help you really improve the results with your patients and clients, then I want to invite you to check out the Performance Redefined course. This online course is not only approved through the NSCA and the APTA for CEUs, but it's also going to help to really raise your coaching standards. It is completely online, self-paced, and you can start completely for free. I will leave the link in the bio, and I hope to see you in the course.